The Appropriations Subcommittee on Labor, Health, Human Services, Education, and related agencies will come together. We're glad to have our friends from NIH here today, Dr. Collins and the Institute directors. A recent support, I think, of medical research from our subcommittee and the full committee and the Congress is clear. During the 3 years that Senator Murray and I have worked together on this committee, we've increased funding for the National Institutes of Health by 23%, $7 billion above where we were just 3 years ago. We've nearly tripled the Alzheimer's research amount, started the Precision Medicine Initiative, and targeted resources really to such revolutionary projects as the Brain Initiative, the universal flu vaccine, and efforts to combat antibiotic resistance. A renewed investment in NIH has provided and can provide millions of Americans and their families with hope that they wouldn't otherwise have. NIH-funded research has raised life expectancy, vastly improved the quality of life for all Americans, and in addition, I'm hopeful that we can see ways to lower health cost and healthcare cost and to create economic growth by supporting the jobs, the research, and the innovation that are such an important part of dealing with healthcare issues now. Both this administration and the last one have proposed cuts in NIH funding. There's rarely a straight line in success, but so far we've been able to maintain an upward momentum in the opportunity that I think everybody on this committee, on this subcommittee, certainly sees at the moment we're in. In addition to that, things around the world like the West Africa challenge 3 years ago with the devastating outbreak of Ebola. The disease killed more than 11,000 people in Africa, became a major public health threat in the United States, and both NIH and CDC were an important part of responding to that. We see now that another outbreak, frankly, in the Democratic Republic of Congo. I think there was more news on that topic even this morning, and need to be well prepared to continue to be able to do what we need to do to respond to those kinds of challenges. Earlier this month, the National Institute of Health launched enrollment in the All of Us study, which will collect health information from 1 million Americans, an idea that Dr. Collins mentioned, I think, 2 years ago for the first time as an NIH goal. All of Us has the potential, of course, to unlock precision medicine for the majority of diseases that we suffer from today. This initiative has the potential to change our health system from a one-size-fits-all to really understanding more about personalized medicine. We're also at a point where we see some drug repurposing happening. We're testing current drugs that we know are safe to see what other uses we might find in those drugs. There's a current clinical trial targeting the most common adult leukemia with a drug first approved to test arthritis more than 25 years ago. That particular work's being done at the University of Kansas. Certainly Senator Moran has been a real advocate for NIH research, and he and I hope to visit the University of Kansas Medical Center before too long and look at that project along with others. The National Academy of Sciences published a report in February that shows that NIH contributed to every one of the 210 new drugs approved by the Food and Drug Administration from 2010 till 2016. That is quite a record, and we appreciate the fact that that work continues. We see increased grants among young researchers. Anything you have to say about that would be welcome. But this has been an effort that this committee has entered into together, and Senator Murray's been a great partner in NIH, as we hope to be appropriately involved in our oversight responsibilities as well. But let me turn to Senator Murray for her comments.